Hello to all future nurses. Welcome to our YouTube channel NCLEX Prep. I am beyond excited to finally upload my very first video over here. This channel is dedicated to helping you conquer the NCLEX with confidence. Whether you are just starting your nursing journey or getting close to your exam day, you will find helpful tips, study guides, practice questions, and motivation right here. I know exactly how overwhelming the NCLEX can feel. I have been through it myself, and that's why I started this channel to make sure no one feel alone while preparing. This is a space for support, clarity, and success. Today we are going to see about the general introduction regarding NCLEX-RN examination. Here in first slide, we will see that what is the NCLEX-RN examination. So the NCLEX-RN or the National Council License Examination for Registered Nurses is a standardized test that every nursing graduate must pass to become a licensed nurse in the US, Canada. It's not just a knowledge test, but it evaluates your critical thinking, decision making, and ability to apply nursing concepts in real life patient scenarios. For example, you might be asked in exam like which patient should the nurse assess first. So this isn't about memorization. This is the prioritization concept. So basically in NCLEX, the system has been used, that is CAT technology, that is computerized adaptive testing, to deliver the exam, ensuring a valid and reliable measurement of nursing practice. So you can get all the other informations about the NCLEX-RN examination. If you are not clear with the information provided over here, you can go to the website www.ncspn.org, that is the National Council of State Board of Nursing. On that website you will get each and every information related to exam, as well as what is the further process to give the exam and what to expect after examination. Continuing the video with the registration process. So the registration for a candidate is being done through Pearson VUE. So as you will reach out to the www.ncspn.org website, there you will see a section about the registration process. So on that, if you see there is a Pearson VUE option that you need to click, and then you will be directed towards the Pearson VUE website. So on that website, you need to be register yourself to give the NCLEX-RN exam. So first they will ask about your general identification, like your first name, your last name, while registering yourself for the examination. Then you will be asked for the program code for your examination. So each country has their own program code. In India it has a different program code, and in Canada it has a different one. So you need to get the program code from the same website, that is ncspn.org. All the information has been provided over there, so you can get all the program code and other necessary information from that website. The next thing, and which is most important, you need it, that is the email address. The email address that you will use over here will be the email which you will get all the confirmation emails from the Pearson VUE after registration of your examination. So select the working email address, which will help you to guide through the process and get the proper information from the Pearson VUE about your examination. And the last step is to provide an acceptable form of payment. So the last step will consist of like payment of the fee. So you need to pay your fees via debit card or credit card or MasterCard or American Express card. All the cards are being accepted, so there will be no rejection of the cards that I mentioned. Continuing with the registration options. So as you will be directed towards the Pearson VUE website, you will see three options to be registered with. First one is the online via the portal, second one is the telephone method, and the third one is the online with the third party payment. So in all the three methods the registration can be possible, but you need to be very precise with your information, like your name, your email address, the payment method. All the things need to be precise, because the mail is important, because as I said earlier, the email ID that you use is very important. The candidate will receive all the email confirmations, acknowledgement regarding the NCLEX registration via that mail from the Pearson VUE. So after completing your registration process within 2 business days, you will get a confirmation mail on your email address that you have while registration. And if you don't receive, then check your spam, because sometimes the email can be found in the spam section too. Then moving forward with the registration time limits. So the nursing regulatory body provides the time period of 365 days. So a candidate who has registered the particular nursing regulatory body has a 365 days of time period within which he need to prepare for the NCLEX examination. He need to register himself for the examination too, and then after like the eligibility has came from the NRB, that is nursing regulatory body, you need to apply for the ATT, that is authorization to test, because without that you are not able to give your examination of NCLEX-RN. So after receiving your eligibility from your nursing regulatory body of a particular country, you need to apply for ATT. ATT will be sent in your email by the PSMU. So you need to check your email very precisely and regularly to miss out any update. And there is important like information that if you miss out the period, that is 365 days, then the fees that you pay for your registration of the examination will be not refundable. So if you didn't get your eligibility, then the fees that you have paid for your registration process will be taken away and not returned back to you. So make sure once you receive your eligibility, then only you apply for your registration process for the NCLEX examination, because it will be like trouble you with the money. So make sure to check all the information in all your emails regarding the NCLEX examination as well as the process. Moving forward with the test accommodation. So the test accommodation is basically a test environment which was created for the special people like who are having the disability. So the Pearson View Center are very advanced, are very like adaptive. They are having each and every arrangement over there. So the Pearson View Center has special accommodation for them, like they can provide extra time. They have a separate room due to the disability, and also they can provide more breaks due to some problem with that special person. So this type of accommodation has been provided by the Pearson View Center. So here comes the main part of the examination, that is the fee structure, which shows for the three countries, that is US, Canada and Australia. So according to me, the fee structure remains similar for the two countries, that is the US and Australia. As we can see that it is a similar, it's 200 USDs in both the countries. But for the Canada, it is 360, as the Canadian dollar as the residents of Canada, you need to pay $360 Canadian dollars for the registration of the NCLEX-RN. Next is the additional international scheduling fees. So if you are giving the exam for the nursing regulatory body of Canada and you are giving exam in India, so you need to pay extra $150 for your international scheduling fee. Like in my scenario, I gave the examination from Canada, but the nursing regulatory body which I have selected first was belonging to the US, so I need to pay $150 extra to give this examination for the international scheduling fees. Then the third is the changing the nursing regulatory body. So if you register your exam and then in some circumstances, if you like change or if you want to change your nursing regulatory body, you need to pay extra $50 according to the country. Like if there is a US, you need to pay extra US $50, and if you are a Canadian, you need to pay extra 50 Canadian dollars. For Australian, it is not applicable, like they don't have the fees to change the nursing regulatory body. Then if you change your like exam type, if you have first registered for the NCLEX-RN and then you have changed to NCLEX-PN, then you need to pay extra $50 for the US seeking license. And for the other resting two countries, there is no fees applicable. And the last applicable fees is for language change. So if the language is a problem and you want to change your language, like if you are a Canadian resident and you want to give the exam in French language, then you need to pay extra Canadian $50 to change the language of the test. That's it. There is no language changing fees in the US as well as Australia. Heading towards the end of the video, so in this part we will talk about the subjects in the NCLEX-RN examination. So the NCLEX-RN doesn't follow your school textbook chapters. It's divided into key nursing domains, each with critical concepts. So first is the nursing foundation. So nursing foundation is the most important topic as well as the subject in whole NCLEX-RN examination, because you will see most of your exam questions related to this particular subject, that is nursing foundation. So it consists of topics like culture, ethics, prioritization and many more. For example, you may be asked which ethical principle applies when a patient refuses treatment. So there are many different ethical principles like autonomy, beneficence, then there's a fidelity and many more. So you will be asked like which ethical principle is applied in this scenario. Yeah, so the next is medical surgical nursing. This is the second most important subject in the NCLEX-RN. So it has topics like cardiac, musculoskeletal, neurology, and many more. So if we take an example, like if a patient with a history of MI, that is myocardial infarction, reports chest pain, so what is your priority action in that scenario? You will be asked like this type of questions. So you need to make sure you have a thorough knowledge regarding each and every terminology, each and every subject of NCLEX-RN examination. The third one is obstetric nursing. So in this, the topics you will be encountered with like labor and delivery, placental conditions, and many more like preeclampsia, eclampsia, PPH, that is postpartum hemorrhage. So in this subject, you will or you can be encountered with the question type like what's the nurse first step when the fetal heart tones drop during the labor. So when a lady is on a labor table and delivering a baby and you are noticing that the fetal heart rate, that is FHR, is falling continuously, so what is your first step to do in that condition? Then the next is a pediatric nursing. So it has a system wise explanation. So it's a similar like medical surgical nursing, but it's related to children, like in children heart condition, in children musculoskeletal condition, in children neuro condition, and there are many more other. So if I give you example like identify early signs of dehydration in an infant, so what are the signs that you will find for the dehydration in an infant, right? Then we are also aware about mental health nursing. So it will have the conditions like schizophrenia, personality disorder. There are many more other conditions which can be mental health nursing. If I give you an example like how would you manage a client having a paranoid delusion, so this type of question can be asked in the exam too. So you need to be prepared with each and every particular condition and have a thorough knowledge of it. Can't miss a single cause, each and every word during this journey. And the last one is the pharmacology. So in this, all the medications from like pediatrics, obstetric, medical surgical nursing, mental health, all conditions having different medications, and that you need to by heart. Do not memorize it, just by heart. Keep your concepts clear because this will help you to pass your exam. Don't mug up. Mugging up will be not beneficial during examination. Just keep your concepts clear and you're good to go for the examination. So heading towards the end of the video, each question you face will test not just your knowledge but your ability to act safely and ethically as a future nurse. And that's wrap up our general introduction to NCLEX-RN exam. I hope this helped you understand what to expect and how to begin your journey confidently. In upcoming videos, we will break down each subject with real examples, test strategy, and tips to help you pass on your first try. So don't forget to like, subscribe, and hit the bell icon so you will never miss an update from NCLEX Prep. Thanks for watching, and remember, you have got this. Thank you.